Diabetes Connections is brought to you by Dario Health. Manage your blood glucose levels, increase your possibilities. By Gvoke Hypopen, the first premixed auto-injector for very low blood sugar. And by Dexcom. Take control of your diabetes and live life to the fullest with Dexcom.
This is Diabetes Connections with Stacey Simms.
This week, the term Walmart insulin has always referred to cheap, older formulations until this summer. A new agreement with Novo Nordisk means Walmart is selling its own branded version of Novolog.
Real sense of pride for us at Walmart to hear the great feedback. Our pharmacists and pharmacy teams are very excited about the product and how they can help support patients.
That's Michael Burke, Director of Brand Pharmacy Merchandising for Walmart. We'll talk about who can get this, how much it costs, why now, and what's next. This podcast is not intended as medical advice. If you have those kinds of questions, please contact your healthcare provider. Welcome to another week of the show. I am your host, Stacey Simms, and we aim to educate and inspire about diabetes with a focus on people who use insulin. My son was diagnosed right before he turned 2 back in 2006, and my husband lives with type 2 diabetes. I don't have diabetes, but I spent my career in broadcasting, and that is how you get the podcast. Earlier this summer, as many of you probably remember, Walmart announced its new agreement with Novo Nordisk. It is selling the same insulin that they make under the Walmart brand. So it's called Relion Novolog, and it's sold at Walmart and at Sam's Clubs. Now, this is not the older $25 so-called Walmart insulin. That includes older versions such as regular and NPH, which can be used safely if you know what you're doing, very rarely used in pumps, and very rarely prescribed as a matter of routine. They're not the standard of care for modern day diabetes, but people do certainly use what many of you refer to as Walmart insulin. They still do use regular and NPH. But the vast majority of people who probably listen to this podcast and are regularly seeing an endocrinologist and have been diagnosed, let's say, within the last 30 years, are probably using Novolog, Humalog, and the newer, faster acting insulins. So because Walmart is selling Novolog, we might have to change what we mean when we say Walmart insulin. And now that the dust has settled a bit, I thought it would be a good idea to find out how it's going and what it really means for people who use insulin. Unfortunately, I don't think it's changed the marketplace a lot. What it did prove, at least to me, is that the retail price of insulin, with or without insurance, is as arbitrary as most of us suspected. I mean, pardon my cynicism here. I do appreciate the folks from Walmart coming on to talk about this, and I appreciate that they're doing something. I'm sure this new pricing will help some. It is $73, though, for a vial, when the estimated cost of producing that vial is maybe $4 to $6. So it is still quite high. And that is the cash price, by the way. With insurance, as you'll hear, it is likely a lot lower. So going in, please know, and most of you already know this, bottom line, ask your doctor, ask your pharmacist, make sure you are getting the insulin that costs the least for you according to whatever plan you have. There are so many hoops to jump through to ensure this. If you don't have great insurance, you may want to go to getinsulin.org. That's a clearinghouse put on by Beyond Type 1. And all it really does is bring all the coupon programs together. So it's one place where you can find out what you can get. Getinsulin.org. I will link that up in the show notes. We used it because, as you'll hear in the interview, and I've shared this before, our current insurance does not cover the insulin that my son uses and wanted to keep using. And we needed to use coupons for that. It did help us. If you're struggling, if you can't find these resources, post in the Diabetes Connections Facebook group. You are more than welcome. We have a lot of great people who can help you figure this out. But, do what you need to do, as frustrating as it may be. Don't ration your insulin if you can possibly help it. I know that sounds ridiculous to even say that. But look, 1 in 4 people in this country do ration their insulin. So maybe there's something that we can do to kind of help you, as I said, jump through those hoops. All right, Michael Burke, Director of Brand Pharmacy Merchandising, in just a moment. But first, Diabetes Connections is brought to you by Dario Health. And we first noticed Dario a couple of years ago at a conference. Benny thought being able to turn your smartphone into a meter was pretty amazing. And I'm excited to tell you that Dario offers even more now. The Dario Diabetes Success Plan gives you all the supplies and support you need to succeed. You'll get a glucometer that fits in your pocket, unlimited test strips and lancets delivered to your door, and a mobile app with a complete view of your data. The plan is tailored for you with coaching when and how you need it and personalized reports based on your activity. Find out more. Go to mydario.com/diabetes-connections. Michael, thanks for joining me. A lot of information to get through, and I appreciate you coming on.
Thank you so much for having me.
Let's just start with kind of an explanation, if you wouldn't mind. Take us through what Walmart is doing here. What's the new version of insulin that Walmart is selling?
So we have recently launched analog insulins. We can get into here in a second, the difference there, but it's an extension of our current line of insulins. So the insulins that we've had at Walmart for some time now is the human insulins, or the Novolog products. Our extension and new launch now is an analog insulins, which are the newest version of fast-acting insulin and can help better regulate someone's blood glucose levels. Very excited that we were able to get into this. It's been a large topic in the industry for a while on why we were just at human insulins as a private brand offering and what more we could do. So very excited that we got into the analog insulins, as it is the insulin to be used for a type 1 diabetic and preferred in most cases in type 2s.
Can you share a little bit about what happened here? Because this isn't something that Walmart could just do, right? This is a version of Novolog. I mean, this is an agreement with Novo Nordisk. Can you kind of take us through what the process?
Yeah, so we have had a long-standing relationship with Novo. They are the manufacturer of our human insulin, the Novolog, Relion products that we've had on the market. And so with the changes of recent in the industry and a real focus, I'd say, from kind of across the board, from legislation to patient advocacy to patients, manufacturers to pharmacies to prescribers, there's been a large focus over the last 2 years on what more can be done in the space. And so it allowed us an opportunity to work with Novo and expand what we already had on the market as a private brand offering and bring a new private brand and new Relion offering in the Novolog and Novolog mix, both in a flex pen and vial, and offer a lower cost option for patients who had struggled with affordability to this point.
This is a branded insulin. So you get Relion, a brand, Novolog, only at Walmart. Is that right? Is that how it works?
Yes. It's so, like everything healthcare, it's got to be confusing, right? So Novolog is the branded name that is the FDA filed and trademarked product from Novo Nordisk. What we have done is partnered with Novo Nordisk to launch a Relion Novolog and a Relion Novolog mix. Same product, manufactured by Novo Nordisk, manufactured here actually in the US, and comes off the same production lines, is the same insulin. The difference being that it is branded with Walmart's private brand of Relion, which enables us to bring that in-house, to self-distribute to our stores, help support our customers. And so it offers us the opportunity to cut out some of the middlemen, lower the cost, but still the same great product manufactured by Novo Nordisk, still the same as their branded Novolog and Novolog mixes, just with a private brand twist from Walmart.
So this was announced in late June, as I remember. How has it been? Is it out now? Are people able to purchase it? What's the rollout been like?
It is. So we started with the Novolog vials and the Novolog mix in our Relion brand, the Novolog vials and the Novolog flex pens in our private brand of Relion. And then this last month, we were able to launch the mix in Relion flex pens and vials. So the regular Novolog has been out a little bit longer. We're seeing really good traction, got wonderful feedback from patients, prescribers, various members of the industry, and has been a really good reaction to this point. A real sense of pride for us at Walmart to hear the great feedback. Our pharmacists and pharmacy teams are very excited about the product and how they can help support patients. We've heard lots of testimonials on where we've been able to save patients money and where patients were able to come to us and afford their insulin and not make different choices. And so it's, for us, been wonderful since launch now. We want to keep that momentum going and make sure that we're reaching as many patients as we can and providing as much value and access as we possibly can in the insulin space.
I had some interesting questions for my listeners, if I could bring them to you. And the first one was, is there a limit to the amount that you can purchase per person per month?
There is not. So these products, the newest launch, the Relion Novolog and Relion Novolog Mix, are prescription required. So as long as there is a valid prescription, there is no minimum or maximum that a patient can get dispensed at a time. A little bit different than our human insulin, which did have some limits on how much you could purchase at a time without a prescription, just due to some varying risks and inability to keep in stock.
You've mentioned the mix a couple times. What is the mix?
It's a 70-30 mix of analog insulin. So it's a fast and intermediate acting. And so for some patients, it is a better way to manage some of their peaks and valleys, is to use an analog mixed insulin rather than just a single type of analog insulin and fast acting.
Is there, and again, I pardon my ignorance, isn't there a 70-30 human insulin? This is different, or this is?
There is, yes.
Okay.
Insulin's a bit of a rabbit hole. In the various types of insulin, there are also mixes within them. So there are also long-acting insulins, and there's some mixes in long-acting or the prandial insulins. There's human insulins, which were the original insulins on the market that have mixes as well, and the analog insulins have mixes. And it's really just help provide variety for patients and prescribers that may not be seeing the right results with a single insulin. Sometimes a mix, depending on what type of mix it is more beneficial in lowering blood glucose or maintaining the proper levels. Sometimes it's helpful in some patients that have peaks and valleys and struggle with that.
Yeah, I just didn't realize, it's my ignorance, I didn't realize that there was a 70-30 analog. All right, another question from the group. I had another question. Are they going to encourage providers to prescribe, or is this solely an option for people with high deductible plans / no insurance?
So wherever there is a prescription, we will process whatever type of insurance, where our goal is to have the lowest cost for a patient we possibly can. So may that be on our private brand insulin, may it be on a brand or a different branded insulin. Every time a prescription comes to the pharmacy, we do our best to make sure that we're going to give the lowest price. So our branded insulins continue to have some coverage today. Our private brand does as well. So best opportunity is for patients to work with our pharmacy teams and make sure that they're getting the right insulin at the lowest cost possible for them.
So I'm going to ask you a question you may not be able to answer, and that's fine. But for clarification, so my son, our insurance currently covers Novolog and doesn't like Humalog. It doesn't prefer it. So if I were to get a prescription and go to Walmart, would my doctor have to write it for Novolog? Would they have to write it for Relion Novolog? Would I have to know? Could I possibly be saving more money if my doctor knew about Relion? Or does the pharmacist look at this at Walmart and say, oh, you want Novolog, but it's going to cost less if you use the Relion version? Right back to Michael answering my question. But first, Diabetes Connections is brought to you by Gvoke Hypopen. And low blood sugar feels horrible. You can get shaky and sweaty or even feel like you're going to pass out. There are lots of symptoms, and they can be different for everyone. I'm so glad we have a different option to treat very low blood sugar. Gvoke Hypopen. It's the first auto-injector to treat very low blood sugar. Gvoke Hypopen is pre-mixed and ready to go with no visible needle. Before Gvoke, people needed to go through a lot of steps to get glucagon treatments ready to be used. This made emergency situations even more challenging and stressful. This is so much better. I'm grateful we have it on hand. Find out more. Go to diabetes-connections.com and click on the Gvoke logo. Gvoke shouldn't be used in patients with pheochromocytoma or insulinoma. Visit gvokeglucagon.com/risk. Now back to Michael Burke answering my question about how much the pharmacist can do for you if you bring a regular old Novolog prescription to Walmart.
Yes, for a Novolog prescription, our Relion Novolog private brand is interchangeable by the pharmacy or by the pharmacist. So a patient who has a current Novolog prescription, our pharmacist can check to see if our private brand through insurance or other means would be a lower cost for that patient and can do that interchange themselves for those products. So just Novolog to our private brand Novolog. If a patient has a prescription for another type of analog insulin that is not interchangeable with our private brand insulin, the pharmacist can verify insurance coverage for the patient and work with the prescriber on if it's appropriate to switch to private branded Novolog or to remain on the insulin that they're on today. So we can interchange with the Novolog branded products themselves, but for other products, it would be a conversation between the pharmacist, patient, and prescriber to make sure they're getting the right insulin at the best cost for them.
Mike, you're going to have to forgive me as we move forward. We're going to start moving into more of a cynical part of the questions here because, as you've already alluded,
not a problem.
This is the rabbit hole. And, I mentioned Novolog and Humalog. I mentioned that our insurance doesn't like Humalog to the point where, and I've shared this story on the show, my son has done really well with it for many years. So when we changed insurance, I did not want to change insulins. So it took a long time and some fighting, but I was able to use the coupons for Humalog. And we get Humalog for about $35 a month for all of the insulin that my son needs, which would be less, I believe, than if I were to use my insurance coverage and get Novolog or Relion at Walmart. I still feel like, even though this will save some people some money, it just kind of feels like we're moving pieces around on the board. I guess my question would be for Walmart is, how did you arrive at this price? Did you have to, and did you have to set it a certain way to get the deal with Novolog? This is going to sound terrible. Do you throw darts at a board? I mean, because for some people, it's going to be more expensive than what they're paying now. And I get some people will save money, but how did you come up with the price?
Yeah, so for us, we are one piece of the equation. As we've mentioned, healthcare is very complicated, especially the financial flows of healthcare. And so Walmart is one part of the financial equation as the dispensing pharmacy. We also have a distribution network and other assets that we utilize within Walmart. And so what we have done is taken all of our assets, tried to remove as many of the middlemen as possible, and put all of that back into the customer savings, customer pocket. We can't control all the levers there are in healthcare, but where we can, we put it right back into the customer's price. We truly mean it in Walmart, and especially in Walmart Health and Wellness, of the live better and save money, right? Save money, live better is Walmart from the core. It's the only way that we could do so was to take where we could remove some of the excess cost and put it into that cash price. Very complicated on the back end of who's making what decisions on formulary and additional savings and eligibility for manufacturer discounts and coupons and on down the line. We can't control all of those, but what we can do is continue to take whatever we can out of that cost, that inflation cost in the insulin, and put it right back into the cash price. And in that effort, hope to continue to drive down the overall cost of insulin for the marketplace.
Can you share, is this an exclusive contract with Walmart? This was another question from one of my listeners. In other words, could other providers like Express Scripts or even Amazon, one of these folks that's getting into the pharmaceutical, medication supply side, could this be a first step toward other people doing something similar, or is this exclusive?
So the Relion private brand is exclusive for Walmart. That is our trademark brand at Walmart for our insulin and diabetic supplies products. So others couldn't utilize our Relion, but we hope that this is part of others stepping up and also looking to see how they can impact the space and how they can drive down costs. For us, it would be a great win if there was competition in the space and we started to see insulin prices across the board come down, because a competitive market only benefits the patients, and that's what we're looking to do. So we'd be happy if others were able to get in the game and figure out different ways to drive down costs for customers, because at the end of the day, if there's an affordability issue, we won't be able to curb the growth of diabetes.
I'm curious, and again, this might be a ridiculous question, but with your answer in mind, do you have an agreement with Novo in terms of how low you could get that cost? Because, let's be honest, if you knocked the cost down, it's, $72.88 per glass vial or $85.88 for 5 flex pens. If you could knock that down to $35, you'd basically corner the market. No coupons or anything like that. Was that even discussed?
Our focus is always on how can we drive the lowest cost, lowest price possible. We'll continue to focus on that. Like I said, there's only so many of the financial levers in healthcare that we own at Walmart. And so we will continue to do our part to take out everything we can from our end to make sure we're driving down prices and costs. But we only own so many of the levers. So we continue to look to Novo and other partners to help us continue to drive those prices down.
With the pricing that I just mentioned a moment ago, are any coupons accepted for that? If people have Novolog coupons, are they good for Relion Novolog, or is that something completely separate?
Yeah, that's completely separate. That's for qualified programs for their branded product. We don't have those today on our private brand product. What we continue to look at is how do we take the cost of those programs and put it right back into our pricing, because everyday transparent low price is what we're looking for. As you mentioned earlier, the different insurance coverage and copay assistance and discount cards and manufacturer discounts on down the line just makes healthcare so complicated for the average patient. And so our goal is to not continue to build those additional steps and needs and trap doors and not put that pressure on our patients to need to go out and hunt and find those, but rather continue to put that right back into our cash price and make sure that we're offering as low as we can price on these insulins in a transparent way. And that will continue to be our focus. Just making this more complicated isn't going to help patients with affordability and access. Continue to simplify a very complicated healthcare arena, especially in insulin, is to the benefit of all of our partners.
Just to be clear, and the prices that I mentioned, is that someone who doesn't have insurance? That's just a cash price?
Yes, that is our cash price, and that is the starting price. So if a patient has insurance or a different type of coverage, then we will process and see their eligibility and what their coverage will do and where that will bring down the price. We're seeing pretty good coverage so far since launch across the board, but that continues to change. And as you said, there are different formularies and different pricing tiers out there. So what we say is the highest you're going to pay for that box and vial is those prices, but we'll try to everything we can to run insurance and check for every possible way to save money from those prices.
Here's another question from my listeners. Are there any plans to offer the in-pen cartridges, which is a different product than Flex pens?
We don't have that today. We continue to look in the space for whatever we can continue to offer and do. But today we do not have that as a product offering.
Any plans to do this with other insulins, long-acting or different brands, or Humalog or Tresiba, any other types of insulins that are out there?
We continue to look for opportunities kind of across the board, from our generic team to our specialty team to the branded team that I'm on, to figure out what are the best ways to save our customers money and make sure that they can be adherent to their medication. So I can say that we'll continue to look at opportunities. Diabetes is obviously a growing issue in the United States. It continues to create barriers for our customers, our patients, our families. So we'll continue to invest time and effort in the space and make sure we're doing everything we can to do our part to help increase access, decrease costs, and support our patients in their journey in diabetes.
I appreciate you taking on my questions. I mean, I know you hear the frustration in my voice and my listeners' comments and questions, because it just seems, and I can't say this is Walmart's responsibility, but it just seems like we've been told for years and years that, the price is because of research and, the development, and then to just suddenly say, well, you know what, we don't need to sell it for $300. We can sell it for $72.88. It kind of seems absurd from where we all sit. And I know it's complicated. And I guess there's no question here, Mike, but I could just say to you, please, as you move forward, I know everybody needs to make money. I know that's how this system is. But if Walmart really wants to, improve lives, improve access, please keep pushing to lower the prices, because it does make a difference. 1 in 4 Americans is rationing insulin right now. And while this helps, it also points out how, frankly, broken the insulin pricing system is. So I appreciate you doing what you're doing, and I appreciate you taking these questions on. And really just thanks for listening to me talk about that as well.
Yeah, I appreciate your time. I appreciate you having me on. Like you said, we're here as Walmart to continue to do our part we're invested in making our communities healthier, both from a customer standpoint, an employee standpoint, a community standpoint. So thanks for having me on. Glad to talk to you. I understand the frustration. I've lived in this world for a long time. So I've lived in the frustration. I feel it. I'm a pharmacist myself, and this has been a very complicated space that, quite frankly, we'd love to add some light to and make easier, make more affordable, and continue to drive better outcomes for patients.
Mike, thank you so much.
Appreciate you having me on, and tell you we'll continue to do our part.
You're listening to Diabetes Connections with Stacey Simms.
More information at diabetes-connections.com. Of course, there's a transcript along with each episode now, and I will link up more information about the Walmart program. I'm also going to link up a column I thought was fantastic from the LA Times by David Lazarus. He wrote all about this earlier in the summer when it first came out. He lives with type 1. He gets it. And it's an interesting look at the marketplace and what he thinks with Walmart entering, what he thinks it shows about the price of insulin. He's a great writer. I'd love to have him on the show sometime, but I'll link that up. All right, Diabetes Connections is brought to you by Dexcom. And, it is hard to remember what things were like before we started using Dexcom. I really haven't forgotten, but I guess what I mean, it is so different now. When Benny was a toddler, we were doing something like 10 finger sticks a day. Even when he got older, we still did at least 6 to 8 every day, more when he wasn't feeling well or something was off. But with each iteration of Dexcom, we've done fewer and fewer sticks. The latest generation, the Dexcom G6, eliminates finger sticks for calibration and diabetes treatment decisions. Just thinking about Benny's little worn-out fingertips makes me so glad that Dexcom has helped us come so far. It's an incredible tool. And Benny's fingertips are healthy and smooth, which I never thought would happen when he was in preschool. If your glucose alerts and readings from the G6 do not match symptoms or expectations, use a blood glucose meter to make diabetes treatment decisions. Learn more, go to diabetes-connections.com and click on the Dexcom logo. Before I let you go, a couple of housekeeping things. Please send me your Dear Dr. Banting audio. If you have not heard me talk about this, I am collecting from you what you would say to Dr. Frederick Banting, the man credited with the discovery of insulin. Of course, there were many people helping him, but the Banting House Museum has an exhibit of print Dear Dr. Banting letters. I thought it'd be really fun to do an audio version. So let me know. I'm going to link it up in the show notes. There's a whole blog post on diabetes-connections.com about how to do it. It's very easy. Just use your phone. But you got to get those to me by the end of September. And looking ahead, I'm doing a little bit of where are we going because we're starting to go places again, a little bit here and there. I've got some virtual and some in-person stuff coming up, Delta permitting. So the virtual stuff, I'm really excited. Next Tuesday, so if you're listening as this goes live, it is Tuesday the 21st. My JDRF local, but I think this is open to everybody nationally, and I'll put this in the Facebook group. JDRF is starting something for older people with type 1. And I say older very judiciously because I believe I'm in this group, not with the diabetes, but in the older. Basically, there's a lot of issues that people are facing as they hit, middle age and older age. And it's not just Medicare. But there's a lot of questions people with type 1 may have. And interestingly, I do a lot of research for this show. My listenership, very dedicated older folks, again, I'm in this category now as I'm turning 50 in the month of October, but who are interested in issues pertaining to type 1 and their health as they get older. So I'm doing all of this to say next Tuesday, the 21st, JDRF has an online event that you can join in. I'm going to be doing a little bit of my in the news for this group, but it's going to be news that I have curated that is all to an older crowd. And I'm probably going to do it for 60, 65 and up. I think that the insurance, cutoff there makes perfect sense to try to find things that work for that group. But there is a Facebook group, I believe, that they've started as well. So more info on that. And then later in October, we've got the She Podcasts Conference out in Scottsdale, Arizona. That's the other group that I take part in quite a bit. I'm helping them out. It's women podcasters, obviously. Big group, really excited to hang out with them. And we'll see in terms of, how many in-person events happen in the weeks and months to come. Hopefully they start picking up again, but lots of virtual stuff going on as well. So if you want me to come speak to your group online or in person, please let me know. I'm always excited to do that. And we gear it to, whoever I'm talking to, parents or adults with type 1, whatever you need. Thank you, as always, to my editor, John Buchanan from Audio Editing Solutions. Thank you so much for listening. We've got In the News live on Facebook every Wednesday at 4:30 p.m. Eastern. And then that becomes the In the News episode that you can listen to right here every Friday. So I'll see you back here soon. Until then, be kind to yourself.
Diabetes Connections is a production of Stacey Simms Media. All rights reserved, all wrongs avenged.